Welcome to Lifetime Talks and our special series on longevity and performance with MIORA. I'm Jamie Martin, and I'm here today with Dr. Greg Pippert. He is the medical director of MIORA. And in this episode, we are talking about hormone optimization, a man's guide to vitality. In our modern world, hormonal imbalance in males are on the rise. And we're going to talk about what's behind this, how to know if your hormones might be on the fritz, and what you can do to start addressing any issues you might be having. Okay, Greg, we're back on this topic, hormone optimization. How are you?
And wonderful. Thanks for having me. So,
Yes.
yeah, we'll talk a bit about male hormones now. So,
Let's get into it. We're getting into it. Okay, so why are hormone issues on the rise for men? And honestly, they're on the rise for both genders. So what's
eh,
going on?
yeah. So, first of all, we think about, why are we hearing about it? Partly it's because it's all over the internet. People are talking about it. Guys didn't used to have conversations about, I'm having problems with this area or that area in my life. It was much
Yeah.
more private. Now, people are a little more willing to share, in part because there's more forums like this. And there's
Yes.
also providers that may want to talk about things. But hormone levels really do change with age. So,
Yes.
now, part of that hasn't changed. Men's hormone levels start to drop about 1%, maybe 2% a year after the age of 40. So there's that slow and gradual decline. Now, there is a little difference between men and women. There's a
Yeah.
lot of differences.
Right.
But
Yeah.
one difference is with guys, it's a bit like the frog in the boiling water.
Mm,
We start to gradually go down and down and down. We're comparing ourselves to last week or last month. We're not comparing ourselves to, 3 years ago, I could do this and I can't do that now.
right.
In females, you have very defined changes. You've got changes in your cycles. Suddenly a cycle that was there for, the majority of your life is no longer there.
Right.
I think something's up, or I'm having hot flashes. They're uncomfortable things you really would like to go away. Guys, it's just like, yeah, I'm getting older. Don't feel quite the same. I just don't really feel like doing that. And that's a trap we get into
Mm,
because we just, no, we don't address that. Now, on a kind of a related note, hormone levels really are changing. And this is where it really gets concerning because there was a study, I think it was 2020, somewhere in there. Um, they looked at men's or adolescent males and younger men's hormones from about the age of, I think it was 15 to 40, over about 15 or 16 years.
okay.
And over those 15 or 16 years, the average testosterone level, total testosterone level, dropped by 25%. That's huge,
Mm,
25%. So the average maybe at the time of the start of the study was about 600. At the end of the study, 15, 16, 17 years later, it was about 450.
okay.
So those are real meaningful things. And the really concerning part is this is not occurring in elderly people. This is occurring in guys in their 20s. So we're seeing these things earlier. Now, why?
What's behind it? Right.
Have we
Yeah.
mutated? No, we're suddenly not turning into a different being. It's our environment.
Yeah.
It's our lifestyle. There's so many things that impact that. Now we think about stress, cortisol. Cortisol's our friend when we're stressed because it helps us to run faster and fight and get away. It's not our friend when it comes to making and dealing with hormones because our hormones won't interact with our receptors as well when we have high cortisol levels,
Okay.
and our hormones are not produced as well when we have high cortisol levels. So it's we need it, but we don't want too much. And we're bathed in stress these days. We don't go from I'm running from a threat to I'm relaxing. We just go from threat to threat to threat.
Yep.
There's also our diet.
Yep.
Nutrition poor. We're not getting the right micronutrients. We're getting obese. We're getting insulin resistant. When we have high blood sugars, our hormones don't work as well. We're not exercising. That also contributes to the obesity and the insulin resistance and diabetes. And then we think about the biggie, endocrine disrupting chemicals, and that's where I'm more suspicious about some of this change in age. It's
Especially when it's getting younger and
yes,
younger, it seems
yes,
like we're
because we're
noticing.
exposing ourselves, we're bathing ourselves in chemicals.
Yeah.
And then these things from pesticides, herbicides, plastics. We shouldn't be microwaving in plastic. Please
Hmm.
don't do that.
We hear that, right?
Yeah, but
Avoid those
those we call
microplastics.
them endocrine disrupting
Mhm.
compounds because what do? They disrupt the endocrine system, our hormone system. They truly do disrupt it. So we don't signal for hormone release. We don't use the hormones in the same way.
Yeah.
And therefore, we're seeing these levels go down.
Mm. It's so interesting. Just you think about how many things have changed probably in the last 50 to 60 years in our culture in terms of just those shifts. And then to see those kind of studies coming out about like adolescent changes and into those 20s.
And a lot of these chemicals we're exposed to, we just take for granted. Oh, I love that scent.
Yeah.
Oh, that's a nice scent. They've never been tested on humans. We
Right.
don't know what they're doing. And if you're breathing it and smelling it, it's getting inside. If you're putting it on the skin, it's being absorbed.
Right, and that's what's so interesting, not to go down a rabbit hole here, but just even with fragrances, because there's often, like, there's proprietary information, so even though there's, like, a broad, like, umbrella around it, there's not specifics, so you really don't know what you're being exposed to.
And then there's chemical herbicides, pesticides. It's in our food residue, or
Yep.
the residues in our food. They're everywhere.
Yep, okay. So what does a hormonal imbalance look like in men specifically, and what might it feel like for them?
Right. If you were to query people about, what's hormone imbalance in a guy, they're going to talk about erectile dysfunction and
Mhm.
libido. I mean, that's top of mind.
Yep.
But really, when you talk to guys, that's often not what showed up first, and it's an impactful thing, and it brings it to light because it's something you may not be able to hide from your partner.
Right.
You can hide the fact, or at least mask the fact that you're tired, you're achy. So some of the things we think about, or that we see, are guys are tired.
Mhm.
We don't recover as well. We can't build muscle mass as well. Our recovery from exercise is not as good. And then we do things like, well, I'm just going to start overtraining,
Right, so
which
we
is
go the other
yes, it
extreme,
compounds the
right?
problem. Um, and then there's mood. We get depressed. We lose interest in things. Motivation is lower. Guys will say, that work reading list that sits on my bedside stand just keeps getting taller and taller because I can't focus. I can't make it through. I just don't really want to read that stuff.
Yeah.
And we stop pulling away, or we start pulling away from things we used to enjoy doing. I
Mhm.
don't know why I don't fish anymore. I love
Right.
fishing. I should do that, but we don't.
Hmm.
So we start pulling away from social interactions, partly maybe because we don't have the energy.
Right.
And then then you can start to spill into like erectile function and all that stuff. But it's
Yeah.
that precursor stuff that really affects our quality of life.
Yeah. Well, are there specific ages when more of that seems to be happening with men? I mean, like you said, it can happen early. It's happening earlier and earlier, but women, we talk about perimenopause all the time. But are there specific ages when hormone imbalances tend to kind of come to the
Yeah.
forefront?
So a lot of it depends on our lifestyle.
Okay.
We ride hard, we may hit that wall a little faster, a little earlier.
Yep.
But as I was talking earlier, after the age of 40, we do start to see a meaningful decrease in the hormone levels themselves. So
Okay.
there's that inflection point. But times of stressors, physical illnesses, anything like that that stresses the system may accelerate the change at those intervals in time. People often talk about, I was good until this
Mm,
happened. And it wasn't necessarily the thing that happened, it's how your body responded to that thing.
right. So how you like the outcomes from it, the things that you finally slowed down probably to notice
Mhm.
in that instance, right?
Yeah.
Okay. What about those key male sex hormones? Because we want to talk through like what they are. We
Yeah.
think automatically of testosterone, but we also need to talk about estrogen, DHEA, and DHT. So let's dive into the roles that each of them play in when it comes to male sex hormones
Yeah.
specifically.
So, as you said, testosterone, the male hormone that we think most about. So, think about like sexual development, body hair, facial hair,
Mm-hmm.
but also muscle mass, bone health in men, um, energy, libido, fertility. Those are all things that we think about testosterone. Now, we rarely think about, or we should think about it more, but we rarely think or ascribe estrogen as a male hormone. It is. We need estrogen. We need estrogen for things like joint lubrication. When we don't have as much estrogen, if it gets driven down too low, we're not making it, we get stiff, we get
Yep.
sore, we get achy. But we don't have ovaries, so we don't create estrogen in that way like a female does. We get it from an enzyme that turns testosterone into estrogen.
Mm,
Now, the problem there is that when we increase testosterone, however we choose to do that, estrogen may come along for the ride.
mm,
So you try and fix one imbalance and you create a secondary imbalance. What
okay.
does that look like? Well, unexplained weight gain, breast enlargement, nipple sensitivity, getting tearful, irritability.
Hmm.
Yeah. So we don't necessarily want to go there. Uh,
Okay, I have my side question on just those 2 is, like, how do you then find the right balance between the 2 if one may rise with the other? Like, what's the
right.
trick
You
there?
look at ratios and balances if we're
Okay.
doing a little bit of math, and there's a general feeling. So we'll tolerate certain levels if we're not seeing problems or side effects. Guys will
Mhm.
sometimes ask me, what's the best testosterone level to be at?
Mm,
My answer is, it's the number that's within the standard reference range of
mhm.
all ages, where you feel well and we're not chasing side effects.
Right.
So if you feel awesome, but you have to donate blood and you've got acne and you're losing your hair and your urinary flow is slowing down, we're doing it wrong.
Right, there's
Body's
something
yeah,
else.
body's throwing us up too many red flags. So we got to back off.
Okay.
Um, so how do we, to answer your question,
Yeah.
how do we assess that? Well, we do testing.
Right.
So we look at the estrogen, the testosterone levels. We kind of look at where they started and where they end up, and the balance between them, and then listen to the symptoms that are going on. Because we can manipulate estrogen downwards in guys.
Mhm.
It's and we can manipulate it upwards by just adding more testosterone. We
Got
don't
it.
add estrogen to guys.
Okay, so there's that's a really good thing to know, like, it just that's how you do it is with that testosterone. Okay, 2 other hormones I wanna make sure we talk about, DHEA.
Yeah, so DHEA is an adrenal hormone. It is a precursor to most of our other hormones, meaning a building block. The body can use it as a raw material. But it's involved in adrenal function, and so it can help with energy, mood, mental clarity, stress tolerance.
Yeah.
Uh, too much stress will lower DHEA production, and as DHEA is going down, we start to notice that fatigue more from the stress. We don't
Mhm.
tolerate it as well. And then there's DHT. So DHT is a direct metabolite of testosterone. Now, from a guy standpoint, it's not necessarily an evil hormone
Okay.
because it's a many times stronger than testosterone. Still goes into the receptor, does testosterone's work. But it can be problematic when it comes to hair follicles. They may
Mhm.
not like it. That's the male pattern baldness. So excess
Okay.
DHT may create hair loss issues,
Mm.
and DHT may negatively affect prostate function or prostate size. We get prostate enlargement, so urinary flow concerns.
Okay.
So it's an okay hormone. We just don't like some of the side effects. So we monitor that to see how easily the male body converts testosterone into DHT.
Okay. Got it. So different than, even though there's similar hormones we talked about in the female episode, just different
Mhm.
nuances, so to speak. So similar, like how we know that sex hormones are not just affecting the reproductive system for men, that type of thing. What about their influence on other body systems,
Yeah,
cardiovascular health and all of those
absolutely.
pieces?
So interesting to talk about cardiovascular health. Historically, a lot of people have talked about it. Even some studies seem to indicate that, or there was a worry that testosterone increased cardiovascular disease. Because the talk is, oh, guys have a higher rate of cardiovascular
Mm,
disease. It must be the testosterone.
mm,
Well, now more recent studies, the Traverse study most recently came out in 2022, I think it was to date the biggest randomized controlled trial of testosterone versus a placebo.
okay.
And at the end of the day, the conclusion was testosterone did not increase the risk of adverse cardiac events.
Mm,
It also did not increase the risk of prostate cancer. So wonderful news to have there.
yeah.
In fact, and then there was a there was a meta-analysis, I'm sorry, of about 51 studies, lots and lots of patients over a very long period of time.
Right.
The conclusions, same as the Traverse study, no increased risk of prostate, no increased risk of heart issues. And in fact, though, they saw that in the men who were on testosterone, there's about an 18% decreased risk of cardiovascular disease.
Hmm.
Now, you think about why that might be. Is it the testosterone? Or is it the fact that guys feel better and we're going to exercise and we're
Mm.
going to stay healthy and we're going to be leaner and we're going to be stronger and we're going to be active longer in our lives? Cart and horse? I don't know.
Right, but that's what's so interesting is, like, you kind of can make a shift that may if you have more energy,
Mhm.
again, that's that cascade effect. What's that next thing that you're gonna do because it's good for you and you have the energy and to
Right.
do it all.
So sometimes looking for the low hanging fruit when we're trying to figure out what's the right order to do things in. Well,
Yeah,
what's going to have the biggest impact on everything else?
got
Start
it.
with that and move downstream.
Is there any connection, like, with a male's hormone production or their tendency to produce hormones tied with genetics in any way?
There is.
Okay.
There is. I mean, there's individual variability. I'll see gentlemen that, walk in the door, and I don't know what their relatives' testosterone levels are, but the guy is phenomenal, and his level might be what for another guy is quite low.
Okay.
And so there's probably some genetic sensitivity to that where they can operate very, very well on a lower level. Other people need higher levels. So, yes, there is. And genetically, how quickly we age.
Yeah.
And also how much of it is genetics versus how much of it we just behave like our family. We eat the
Yeah.
same. We exercise the same.
Yes,
We
like, those
like the same foods,
patterns
right? So
continue.
are we manifesting some of the changes based on, oh, we all like to eat bad things?
Right, right. Oh, that's so interesting. Yeah, it's like uh, the genetics or the familial
Well,
customs or
there's
something.
the way of saying it's the genetics may be the bullet, but it's our lifestyle that pulls the trigger.
Yeah. You mentioned that with estrogen that can help with joint health for men. What about, cognition and
Yeah,
digestion as well for other systems
sure.
or
So
anything else we might have missed in that?
absolutely, cognition. As I was talking earlier, guys will say, "I'm just not getting to that work reading or the things that I need to focus or concentration on." We feel foggy. We feel
Yeah.
mentally sluggish. Now, part of that can be because we don't necessarily sleep as well.
Mhm.
So there is that link, and we like to maintain our cognitive function. So
Mhm.
anything that makes us crisper, our work gets easier. We can
Yeah.
get through our work faster, and we have more time to play and relax. From a gastrointestinal standpoint, almost any hormone imbalance can affect gastrointestinal function, like bloating,
Yeah.
constipation. Testosterone does help move things through a little bit more organized way, so
Okay.
we'll just function better.
Okay. So, you've got kind of these symptoms happening. What tests should you potentially ask for if you're a male who's like, I want to know where my
Sure.
hormones are at right now. What can I ask for? What can they ask for? And go from there.
So obviously, you want to check testosterone, but it's
Mhm.
not just testosterone.
Okay.
You want to check the free and bioavailable, which are the usable forms.
Yeah.
The reason for that is we have a compound in us called sex hormone binding globulin, or SHBG. It's a protein that grabs onto hormones like flypaper, and
Yeah.
we can't use them.
Okay.
So if you're only checking a total, you're going to see a lot of hormone you don't have access to. So you want the free and the bioavailable, see how much you really can use.
Okay.
Then you want to look at estrogen. We want to look at the balance. You want to look at maybe DHT to find out if a guy converts a lot of testosterone to DHT, so that you may jack that up if you raise testosterone. You want to look at DHEAS, the sulfate form, because we want to know how adrenal gland function is. You want to look at cortisol, because if you don't have good cortisol levels, if it's too high or maybe even too low, it's going to impact how those hormones work and how the hormones feel. But then also look at things like hemoglobin, hematocrit,
Mm.
because one of the things testosterone does, which we didn't talk about earlier, is it helps to promote red cell production.
Mm.
So as guys get older, we get a little anemic.
Okay.
We replace our bone marrow with fat. We don't make as many red cells. Testosterone helps to promote red cell production. Now,
Okay.
like all things in life, it's good until it's too much,
Right.
and then the blood can get too thick or viscous. So you really want to look and see what the red count is, because things like sleep apnea
Mm.
can raise red cell counts. You're already going into it compromised.
Oh,
And
interesting.
PSA. Now, we talked earlier, said, prostate cancer is not caused by testosterone.
Yep.
But if a guy already has an elevated PSA, you really want to figure out what's going on. You don't want to feed and water it
Yep.
hormones, and you don't want to encourage an already enlarging prostate. So just knowing where they're at.
What does PSA stand
Oh,
for? Just
prostate specific antigen. It's a
got it.
measure of prostate activity.
How does that fit into the larger context of some of the other comprehensive blood tests that we might do at MIORA? Because I know I think about the metabolic code and
Mhm,
different things we look at. I mean, that's one
mhm.
triad within the
Right.
metabolic.
That is just one of the five triads.
Yeah. Okay.
So when we think about hormone, we're all going to look at thyroid hormone,
Yep.
because there's a lot of crossover in symptoms between, say, sluggish thyroid and low testosterone.
Yeah.
So you want to look at that to make sure you're shooting at the right target. But then we want to look at all the things like blood sugar,
Yep.
because insulin resistance, as we become insulin resistant and our glucose is creeping up, we don't use hormones as well. And we also become more obese and heavy. We
Yeah.
gain mid abdominal weight.
Yep.
But a symptom of low testosterone can be gaining mid abdominal weight,
Yep.
but it's going to be accelerated if we're already becoming, pre diabetic.
Got it.
And so we need to look at that just for long term health as well. Also, just good look at electrolytes and liver enzymes, all the stuff we want to look at to make sure the system is functioning well, so that we would know that there's not any fires we need to put out, and we're not going to create any other problems.
Right. So if you kind of have a whole comprehensive look at the entire system, again, and you can see that this area in particular is an area to focus specifically with that, the other areas are pretty well taken care of, or maybe not perfect, but
Right.
they're in a better place.
At least you know what's on the most wanted list.
Yes, yes, that's a good way to put it. So let's talk about the integrative approaches to addressing health issues, like, a hormone imbalance. What does that look like, and what do like therapeutic options,
Right.
like what would you consider?
Right. So, I mean, first of all, just very briefly, because we talked this one all over there already, but lifestyle.
Yeah.
We talked to somebody about, diet, exercise, sleep, stress reduction. Let's not
Yeah.
shoot ourselves in the foot. Um, let's also just think about, chemical exposure. Anything we can limit is going to make everything else work better. But say we've decided that maybe someone's testosterone level is low and we think we need to do something about it. Well, you can use a nutrient-based approach. There are some nutrients and supplements that can help cause the body to produce a little bit more youthful level of testosterone.
Okay.
So nutrient-based, it's very simple, safe, but then we can say maybe we want to take it a bit further.
Yep.
We can use hormones or medications like enclomiphene or Clomid or HCG, which is a human chorionic gonadotropin, another hormone, to convince the body to make more of its own testosterone.
Right.
So we're causing it to do the right thing on its own. We're not taking over.
Right.
Or we can simply use testosterone in a supplemental form that can be things like injectable creams, pellets.
Got it. When you say nutrient-based approach, what does that mean? Like, what does
So
that look like in
yeah, they're
practice?
herbs, tonkat alley, different things like that, zinc,
Okay.
um, dim diindolylmethane, indole 3-carbinol. It can affect testosterone production, the testosterone estrogen balance. So you can use those herbs and or nutrients to support hormone production and hormone balance without going directly to the hormone.
Got it. Now, but let's say you do testosterone in the medication form. Is that a lifelong commitment? Because that's something you'll
Yeah,
hear is like, once you go on it, you're on it. Like, there's no option for getting off. Like, what would influence the need to have it long term or not?
sure. You can always go off.
Okay.
We're not creating a dependency.
Yep.
Um, but guys feel good, so we choose not to go off.
Mhm.
So when you think about what we're doing, we're using the testosterone within a physiologic norm. We're not excessively treating. We're not
Got
shutting
it.
anything down. So what we're doing is replacing to a level that is more physiologically normal for a younger person.
Got it.
So a guy feels better. And when we stop, your body will resume production to the level of that it's capable of.
Right.
Now that may have been down here is where we started, and
Right.
maybe you're 5 years older now, so it's down here because it would have gone down. So we get you to here, you stop it, you go here. That's the way you always would have felt.
Mhm.
No dependency, but you just go, I don't like feeling this way.
Right.
So we're healthier. We want to stay on it. But have I seen individuals that the testosterone was the catalyst? Yes,
Okay.
because now we get them to exercise and they can go to the gym and they lose weight and they're no longer diabetic. And suddenly they're producing more of their own hormones, especially because they're sleeping at night.
Right.
And they go, I think I can try off of this. And they go, I'm fine. I don't need to take this. So
Sure.
it was a means to an end.
Right, and I think what's so important there is that you're just talking about, again, it can sometimes be that catalyst for change that's really needed long term, and if that can kind of nudge you to take these other or kind of adopt these other healthier habits and stick with them for the long term, great. That doesn't mean you might not have it needed again in the future,
Right.
but that's still something for you to like if you have healthier habits long term,
Correct.
that's good for your longevity over
Yeah.
time.
Because inevitably we know that levels are just going to keep going down.
Yeah. Okay, so we talked about exercise, we've talked about sleep and stress management. Let's get a little bit deeper in the nutrition side of it. Like we often talk about core supplementation. Like what are some of the core supplements that men can consider to really make sure they have that good foundation of nutrition
Right.
there?
So I do like a general pharmaceutical grade multivitamin because it does fill in the gaps, the micronutrients that maybe we wouldn't get in our diet because these days we're a little bit nutrient deplete in the things that are in our foods.
Okay.
Things like iodine, selenium for thyroid, but
Yeah.
also testosterone production, zinc for hormone balance, testosterone production, and hormone metabolism. You can take care of all that with a multivitamin. Don't need to piecemeal these.
Okay. Can
Um,
I ask a quick
yes,
follow-up on that? When you say pharmaceutical grade,
yes.
how is that different from like an over the counter? I just want to make sure
Right.
we
Yeah.
know the
Right.
difference.
So you want something that maybe on the label says good manufacturing practices, meaning that it's made in an institution that uses quality ingredients,
Mm.
sends their stuff out for third party testing.
Okay.
You're not taking their word for what's in there,
Yep.
but we look for higher quality ingredients. Maybe instead of
Got
a
it.
regular B12, it's methylcobalamin,
Got
methyl
it.
B12. So that's when I say pharmaceutical grade, something that they're optimized for absorption and quality forms, and you're not getting the worry about contaminants either.
Got it. That's helpful. That's
Yes.
awesome. Okay, what else? You mentioned the multivitamin.
Yeah. So let's just so magnesium. Magnesium is important for certain steps in hormone production. Also
Yep.
can help with sleep.
Yep.
And anybody that's exercising may burn through magnesium, especially our endurance athletes.
Yep.
We think about like gut health because
Mhm.
when our gut is off, we're more inflamed. Our immune system is off. So a probiotic. Now our gut is constantly assaulted by everything we're eating, drinking, stressors.
Yep.
Uh, Throwing a probiotic in, there's just kind of a little insurance. We're going to keep a good bacteria balance and fiber. Those gut bacteria need the fiber for energy food. It's their food, but
Right.
fiber helps us to detoxify things, helps us to process excess hormones. It helps with inflammation and decreases the risk of colon cancer. So it's all in all, we should get more
Huge.
fiber in. Fish oil, I like, we're very omega-3 deficient
Yep.
in our society with seed oils. So need a little omega-3 to restore that balance because you need omega-3s to have nice, supple cell membranes.
Yep.
So
Okay.
that would be my core, I think.
What about advanced supplementation? If there's some more targeted things that men
Sure.
might need that might be different.
Sure. So for men, things like we'll use the same, like the indole 3-carbonyl didelmethane or I3C or DIM for estrogen metabolism.
Mm,
Something called calcium deglucarate can take care of excess estrogen and get
okay.
it out through gastrointestinal tract.
Okay.
Very safe. Stress. If we're not managing stress,
Yeah.
our hormones aren't going to work very well. So things like L-theanine, which is a green tea extract, it's wonderful for kind of down regulating that stress response. Ashwagandha, a nice adaptogenic herb,
Yep.
can be a little bit calming and help, decrease the discomfort of those stressors. So I'd look at stress, and maybe we might need a little blood sugar support, things like chromium, berberine.
Mhm.
So we can support all these things from a nutrient-based standpoint so that our hormones that we're actually supplementing or supporting are going to work better.
Got it. Okay, so let's put it all together now. You've done the testing, you've got the hormones over here, you've got your kind of your larger comprehensive picture. How do I put this into a sustainable approach? Like what does that look like for someone in practice that when they're working with you at Miora?
Well, first, we're going to listen to them. We're going to find out what their most important symptoms are to them. Because if we haven't addressed that, it doesn't matter that the numbers look better if they came to me because of fatigue and they're still tired.
Yeah.
So find out what their main reason for coming in is,
Okay.
and then try and figure out what you're seeing in this panel that might impact that. And that's your low hanging fruit. Want to
Right.
cover that. So find the most impactful thing, and then work downstream from there,
Yeah.
and figure out what the patient or the person is comfortable working with. Because there's kitchen sink people,
Yep.
and then there's like really linear thinkers.
Yeah.
One thing at one time.
Yep.
And you got to meet people where they're at, because if you give them a kitchen sink and they wanted one thing, it's probably not going to happen.
Well, and you won't stick with it, right?
No.
Like you really do have to understand each individual that you're working with and kind of what their willingness is to kind of follow whatever the plan is
Yeah.
that's laid out. So do you start small? Do you throw it all at them?
And you can tell the kitchen sink people because you suggest two things and they're like, is that all you got?
Yeah. Really? That's it?
That's,
There's got to be more,
but
right?
but working from a nutritional standpoint, throwing the targeted nutrients in, talking to them about, exercise, making sure there's quality sleep, which really should be at the top of the list.
Yeah.
We really need to do that. And then once we've kind of addressed the lifestyle factors, then look at, do we need to support hormones from a nutritional standpoint, from a nutrient-based standpoint? Do we need to take this next step and create more testosterone on their own, say with HCG or clomiphene, or are we going to jump in with some sort of testosterone replacement?
Right. Okay. So this just occurred to me. We talk about the bioidentical hormone replacement in women. What about for men?
That's a topic that's a little bit more applicable to female
Okay.
hormones because there's so many more synthetic hormones for females that we just don't use in guys.
Yep.
Things like the testosterone cream, as we put on it, is bioidentical.
Okay.
The pellets are bioidentical, same chemical structure. Injectable form of testosterone, we have to make it suspend in oil,
Okay.
because testosterone is water soluble. We have to
Okay.
make it suspend in oil so that it will slowly release.
Okay.
'Cause you don't want to inject 4 times a day.
Okay.
So in order to make it soluble in oil, we have to add a little salt to it, salt
Okay.
molecule. When the body sees that, it cleaves that salt off. It comes out in solution. Now it's bioidentical. So it's
Okay.
kind of like one of those, you put it in, it's not exactly identical,
Yeah.
but your body turns it into that.
Okay.
So
Interesting. Yeah, because it's such a big topic on the female side. We want to make sure we know if that's a factor for men too. What did we miss? Any final thoughts on this topic? I mean, we could go on and on. We've moved quickly. We do have a panel on male hormone optimization that we've done in the past as well. That's a little longer. We can point people to. But in the meantime, what else? Did I miss anything?
no, we really covered a lot of a lot of ground here, a lot of
Okay.
stuff. But it is important for guys not to just simply say, "Oh, I'm just getting old,"
Right.
or to have their doc look at them and say, "Oh, your testosterone level of 310 is it's normal. You're fine."
Yeah.
Well, you're 45 and the range of 250 to 1100, you know, this would be your 70-year-old. You're hanging out with the 70-year-olds
Right.
in your 40s. That's probably not the right number for you. How we move that number is up
Yeah.
for debate, but not simply to accept, "Oh, you're fine, your number's normal." It's for all ages.
Yeah.
And then seeking out a provider that's willing to have the conversation, is willing to work with you and figure out, how to best address things. Not just simply say, "Here's your prescription,
Right.
take this shot twice a week and you'll be fine."
Yeah.
There's a lot more that goes into it than that. So finding the provider, and then really embracing the lifestyle changes as best you can. Being honest with yourself, what you're willing to do, because sometimes we're just not willing to give up certain
Yep.
things. But find out what we can that's going to impact, and then giving yourself a little grace.
Yep.
If you take a misstep, forgive, move on, just be as consistent as you can, because that's what's really going to, long-term health-wise, move the needle. We're going
Yep.
to be healthier if we can make those little changes that are like your retirement fund. They build over time.
Yep, and you'll feel better in the long
You will.
term. Yeah, I think one thing you just said there, like that whole idea of being a proactive participant in your health journey, right? It's like you kind of have to be willing to advocate for yourself, but then be a willing and active participant.
No one
So,
has more skin in the game than you do.
exactly. Well, Greg, thank you so much for joining me on this topic. We will have more information at miora.lifetime.life and at experiencelife.lifetime.life if people want to learn more on this topic. But thank you, as always,
Oh,
for joining
thank
me.
you for having me. It was a pleasure.
Thank you.